You asked, and ProactivCare is answering. Last week, a question came in if we could answer what the best standards of practice are to keep residents and staff members safe during this episode of COVID-19. This is a very complex question, and there's no straightforward answer. The answer relies on information from the Centers for Disease Control and Prevention, the Centers for Medicare and Medicaid Services, and your state regulatory bodies. It's important to remember that until information is formalized and put out by CMS, CDC, or your state regulatory body, don't act upon it. You might hear information in press briefings, you might hear things on the news. It's important to be very prudent in the actions that you're taking right now. CMS issued a best practices toolkit to combat COVID-19 on May 13th, 2020. This will be very helpful for you and your team as you're trying to sort out what the best practices really are. The CDC also has information and recommendations. As you're looking through the CDC material, remember, some of it's come out in February, March, and April of 2020 with updates as recently as May 12th of 2020. There's new information about how to cope with residents residing in a memory care or how to help people who have memory care problems from the CDC website. Now that I've discussed where you can find the information from CMS and CDC to help formulate your best standards of practice, let's talk about how you might decide what the best practices are in your facility. Overall, the best practices include, but are not limited to, first and foremost, adhering to the visitor guidelines. This means that you're restricting visitors. It means that you are also managing your entrances and exits, where vendors may be coming and going, and where your staff members are coming in and checking in before work. Number 2, make sure you have a good and solid process for having your staff record their temperatures and doing their self-assessment on their health care. This means that they are recording the information and documenting it so that your facility has a record that you've looked at how they're feeling before they are coming into the facility. It's preferable to have this done before they ever enter your building because that will reduce the risk for transmission of illness. Your policies and protocols for how your staff calls off work should be guided with information from the CDC and CMS. This is a time also to look at how generous you are with your time off, to make sure that people don't feel pressured to come into work even when they're sick, and to make sure that if they're stressed out, they can have a day off if they need it. The third thing that you might want to do as a best practice in your facility is make sure that your staff members are not working in other facilities. This includes how well you handle your physicians and physician extenders. Many facilities are using telehealth processes right now for the majority of their healthcare visits for residents. And we also see some buildings that will have a dedicated physician or nurse practitioner assigned just to that building. But it is absolutely critical that your team members are not working in multiple healthcare facilities because that drastically increases the risk of your family getting COVID-19. The fourth thing that you should try to do as a best practice includes managing stress. Managing stress is important because we know that stress is negatively related to how well people can handle getting ill and recovering from illness. So not only for your staff, but for your residents. This is a time for you as a leader to make sure that you're managing your stress well, so that you're setting the example from the top down. This is also a time to make sure that your activity team is front and present. They should be working double time. The activity department's presence can really boost a sense of well-being, a sense of morale, and can help keep stress levels manageable. The fifth best practice is obviously one that many of you are probably thinking I should have said first, and that's the infection control program. Your infection preventionist needs to be driving this whole process, needs to be referring to validated resources, the CMS, CDC, state regulatory bodies. The infection preventionist is overseeing the entire process. How are you getting the PPE? How are people hand washing? Do we have enough masks going around? Are you doing a great job handling outbreaks, not only related to COVID-19, but also related to your standard infection control protocols? Do you have a good surveillance program in place? How well are they tracking illnesses that are occurring outside of COVID-19 in your building? The sixth best practice that your facility should be looking at is how well it's handling the personal protective equipment. The PPE does need to be rationed. It needs to be counted, reported per CMS requirements, and you need to be able to distribute it to your staff in a timely manner. Recently, I had a phone call from a family member who was very angry. In the building where her son is working, the administrator has a great N95 respirator. This person's son, who works as a nursing assistant, has ripped gear. So he's using a ripped face mask. They're only given one face mask every 2 weeks. And some of the face masks allow coughing, like you can cough through them. The family member was unhappy that the administrator did not respond to the complaint, and the administrator has better gear than the direct line staff. So as a leader, this is really critical to consider. Make sure that your team feels like you're part of the solution. The seventh best practice that you should be looking at is how well you're handling the way your units are laid out. You want to make sure that you're following the CMS guidelines for having specialty units. So do you have a COVID-free unit? Do you have a unit just for COVID patients? And do you have a transition unit? Different states have different requirements for these units, and sometimes they're not being enforced and sometimes they are. The best practice is to make sure if you're in a COVID area, you need to have the COVID unit or COVID hub if you can't house the unit. You need to make sure that you have a transition unit. So if you have admissions or readmissions who may not have any symptoms, but you don't want to introduce them to the general population, you need a place where you can hold them to monitor their symptoms for up to 2 weeks or longer. So make sure that you have this best practice in place. The eighth thing that you can do to help protect your staff and your residents is make sure that you've got a good communication process before you need it. As a facility, you need to have a very high level of transparency right now. You need to be able to let the families know what's going on. Even if your facility does not have COVID in the building and there's no requirement for you to call the families, you still need to have a high level of transparency. That's a best practice right now. So before you're in a situation where you have to figure out how to communicate to everyone, make sure you have a plan for it. The ninth best practice is meticulous documentation. This protects your facility from future regulatory issues. Many of the waivers don't release the facility from the actual work. They release the facility from certain reporting requirements. So you have to make sure that you're meticulously documenting the work that you're doing so that you can get credit for it in the future. This list, of course, is not all-inclusive, and you must refer to the CMS and CDC guidelines and recommendations. But this is where ProactivCare can help you. We can help organize your work so that you can deploy communication, education, and training easily to your staff, to your residents, to your families. We can take your information and put it in a digestible format that anyone can understand. Contact us today to let us know how we can help you be the best facility you can be.